Good evening, students. This is a narration of the first lecture that was already sent on Moodle. And we are going to have two sub-themes, maybe three in this specific lecture. So if we look at our outcomes, here you can see we're going to look at the thoracic skeleton, which we have done quite a bit of during the practical today. And we are going to look at surface anatomy structures, indication of the heart, where will we find the heart, and also at lung volumes. And then something that we have done in a separate video already is the intercostal space. And I will also specifically talk about the blood supply of the intercostal space. I've added this little picture here just to give you an idea of the definition or the division between the thorax cavity and the abdominal cavity. Because here, marked at 20, is two parts of your diaphragm, with the central tendinous part where the heart is located. So here you can see a lung volume, which is quite small in this picture because in cadavers we find that the lung volume is usually smaller because of some shrinkage due to formalin, and there's no air in the alveoli. And just below your diaphragm, we find the liver on the left-hand side. The stomach is about at this point. At this moment, it is covered with what is called the omentum. But this is just an idea of what the division of abdominal and thoracic cavity looks like. Right, surface anatomy. When we look at surface anatomy, we talk about the structures that we can feel or see through the skin and relate that specific structure to the underlying organs. So in the thorax, we have quite a number of structures that we can physically identify by either palpating, so touching the patient, or looking. Most of us, we can see the clavicles. We can also see the suprasternal notch, which is at the top end of the manubrium. We can palpate, some people, we can even see the manubriosternal angle, which is the angle between the manubrium and the sternum. And the manubriosternal angle is at the level of the second costal cartilage. So if you trace your fingers to the lateral, remember I said you can feel the second costal cartilage, which is a bit hard. And then just below that, you feel a sort of a give or a softer surface, which is then the second intercostal space. So when you have to percuss out the hard borders, or you are trying to percuss a specific lung lobe, or kind of find a pathology, you can orientate yourself to which rib space you are by starting at the angle of Louis, or the manubriosternal angle, and then working your way down this at the level of the sixth costal cartilage. Remember, all the other costal cartilages meet up with the sixth costal cartilage. So it's only rib 2, 3, 4, and 5 that have their individual cartilages meeting the sternum. And this specific picture shows us where we will find the different fissures of the lungs on the left and on the right. Another important line to remember is called, in this case it's marked as 1, is the mid-clavicular line. So if we take the area or the length of the clavicle from the manubrium till where it meets up with the scapula, and we divide that in half, we have a mid-clavicular line. And that line we use as a reference all the way into the abdomen, and even as an anterior surface marker on the pelvis. So if we look at our right lung, not ours, the specific pictures, here you can see that I said to you that a part of the lung actually extends above the clavicle. That's the apex of the lungs, and it extends about 2 centimeters above the clavicle. If we have to mark the lungs on the chest wall, we will take a midline, drawing from the 2nd costal cartilage to the 6th costal cartilage. So on the right hand side, we have the lower edge of the lung running from the 6th costal cartilage, crossing the 6th rib at the midclavicular line, and then crossing the 8th rib at the mid-axillary line. So MAL stands for mid-axillary line. And then that continues to go a little bit more down, but also slightly more horizontal posteriorly. And here you can see the posterior on the right hand side. So it crosses the 8th rib in the mid-axillary line. So if we count 1, 2, 3, 4, 5, 6, 7, 8, 9. So there's 8. So if we follow 8, that's the mid-axillary line, the 8th rib. So our lung volumes still extend a little bit downwards posteriorly, and then starts to go up into the midline close to the vertebra. Now on the right hand side, I said we have 3 lobes: superior, middle and inferior lobe, and the superior is divided from the inferior posteriorly and at the front through the oblique fissure. The horizontal fissure we only find on the right hand side of the lung, and it is at the 4th costal cartilage in a horizontal line dividing superior from middle lobe. Right, so here we can see an area there, around there, that is not filled by lung volumes, and that is called a costodiaphragmatic recess. This area is where we will find accumulation of fluid. If there's a hemothorax or maybe a pleural effusion, all the fluid will accumulate in this area, because it's not normally, if you're not exerting yourself and having deep inspiration, this is not normally filled with lung tissue. So let's have a look at the next slide. This is another surface anatomy slide. Here we have the suprasternal notch, the manubriosternal angle, and the 2nd costal cartilage, 2nd intercostal space. If we are talking about the heart itself, you will see that the heart, we can also trace the edges of the heart on the anterior chest wall. So the top left hand side of the heart starts at the 4th, the 2nd intercostal space, on the 2nd intercostal space, and then runs all the way down to the 5th intercostal space, and then horizontally over to your right hand side on the 6th costal cartilage. It has a little bit of an edge on the side of your sternum, so parasternally, and then it extends up to your third costal cartilage. So these markers all have a horizontal and a vertical surface marking. It's almost like a GPS. So if we look at this point here, we can say it is right parasternal, so next to the sternum, in a vertical line, and it's on the third costal cartilage in a horizontal line. If we look at that specific marker, we can say it is in the fifth intercostal space on a horizontal line, and it is in the plane of the midclavicular line in a vertical axis. This is a view of the heart from the side. Here we can see the sternal angle that's horizontal with your fourth thoracic vertebra. And it's at this level that I said the superior and inferior mediastinum are divided. And we will find a lot of other structures at this level. Here we have the xiphoid sternum that's attaching to the sternal body at the level of thoracic vertebra number 9. Okay, I think that is it for this specific recording. I will do the other sub-themes in separate recordings.